Right. Good evening, good afternoon, good morning, good night, even. I don't know where you are in the world, what time it is for you when you're watching, but it definitely is evening for me now. And yes, my name is Mika. I am the host for the Sports Chiropractic Chat Show, the official new FICS World Sports Chiropractic Federation podcast series where we talk to notable names in sports chiropractic around the world. And today I have the absolute and utmost pleasure of the company of Dr. Christine Foss. Hello, Christine. How are you?
I'm good, Mika. How are you?
I'm really well, thank you. Really well. Yes. So I have meant to actually get Christine on the show a little bit earlier, but I had so many people who wanted to barge in front. So, but when finally we managed to catch up and get Christine on the show as well. But yeah, so Christine, as we now all know, is now the current FICS Education Commission chair, and she's been a real whirlwind of influence there and taking things up to another level. So that's absolutely fantastic to have you on board, both on the show as well as on FICS, and I'm sure we will move along in the right direction across the board. Cool. So great to have you on the show and welcome. How's life in the States, Eastern Seaboard for you at the moment?
Well, life is a little bit crazy here, of course, in the middle of the pandemic, but it seems to be quieting down, or maybe we're getting more desensitized to it. So here I'm in New Jersey, so this is kind of close to the epicenter of New York of COVID-19. So I see people, and everybody's kind of managing. We're doing okay. Yeah.
Yeah, quite right. Absolutely. But yeah, like most of us sport chiros at the moment, there's no sports going. So hence we're all sitting at home, or some lucky ones are sitting in clinic twiddling their thumbs as it goes. How's that treating you at the moment?
Yeah, I would like to be relaxing a little bit more, but I'm actually still working. We've just limited the number of patients in the clinic, and we're kind of, wearing scrubs and masks and the whole nine yards, and still treating, but just very limited number of patients per space.
Absolutely. Yeah. Taking care of all the precautions and making sure everybody stays safe.
Exactly.
Absolutely. Good. But yeah, obviously for some of us in various different countries, the situation is a little bit more strict. So of course, we know a lot of our colleagues forced to shut down the clinics, and there's just been given a few weeks off, which I know some of them are climbing up the walls at the moment because, there's just relatively little you can do.
Yeah.
But luckily, though, there's people like your good self.
Right.
So Christine brings, of course, all sorts of wonderful learning materials for the stranded sports chiropractor, wherever you might be.
And it's a good time to pick up a new technique or new skill and get onto a webinar, I think, and
Absolutely.
just read some of the latest research. I think it's a perfect time.
Absolutely. No, you definitely ought to make this time count and upgrade your knowledge, upgrade your learning, and upgrade technical skills. If you just want to be adjusting your spouse and kids, that there's a bit of limited application there as well with the practicalities, but at least the theoretical knowledge you can obtain at this point in time.
Exactly.
Cool. Well, hey, obviously the FICS flagship at the moment is the ICSC program. Do you want to tell us a little bit more about that?
Sure. So the ICSC program is a postdoctoral program. And this program is a certification in which you can learn kind of the nuances of becoming an international sports chiropractor. What it's like to travel with a team, what are the expectations of traveling with a team. It also has about 10 modules to it, where you can really learn the skills that are required when you're working with a team and an athlete. So from everything from head injury to imaging to some rehab stuff to just really the nuances of what it's like to travel, what things you need to bring, considerations like that.
Oh, fantastic.
There's also two hands-on modules that go with that too, and those are jam-packed with great information and adjusting techniques, soft tissue techniques, on the field assessment techniques too.
Absolutely. No, that sounds brilliant. And you know what, that sounds like it's the program's gone through a few changes since I did it back in the dark old days. I can't remember when I qualified for that, something or the other. But yeah, no, it sounds like it's definitely going up a few steps. So yeah, I mean, I think a lot of people are very interested in the hands-on modules. Do you want to go through a little bit of the contents of those?
Yeah. The hands-on modules are super fun. And really, if you think about what you need to know on the field with an athlete, or when you're traveling with a high-level athlete particularly, these are the skills that the hands-on modules have. And it's really not a lot of lecture at all. It is truly a hands-on module. You are there working with a partner, learning soft tissue technique, adjusting techniques for extremities, for spine, head injury assessment on the field the whole time. And that's really the essence. That's why it's called hands-on module, because we want you up and putting your hands on athletes and knowing how to do that by the end of the weekends. So there's 2 weekends, one for upper extremity, one for lower.
Yep. Fantastic. And it basically gives you lots of tools to put into practice as you get back in the clinic on Monday.
Yeah, exactly.
Yeah, absolutely. I remember we had a couple of legendary instructors back in the day when I did my courses, and I went to Lausanne in Switzerland for my courses, and yeah, I think we had Larry and Mike, I think, were the instructors at the time.
Wow.
Yeah, that was a long time ago, wasn't it? Dr.
Yeah.
Larry Paul from Vancouver, and Mike, I can't remember where Mike actually practices now, but you know, somewhere
They're
that
both
place.
in Vancouver, actually, because I just talked to them not too long ago. That's so funny. You bring them up.
Well, there you go. Oh,
Yeah.
do you know what, Dr. Larry was always, he had that legendary tongue thing. I don't know if you ever seen him, you know, when he adjusted him.
I didn't know that.
He was
That's
always,
funny.
as soon as he starts doing like a talus adjustment or whatever, you know, it's demonstrating, and, you know, straight away the tongue goes.
I'm going to look out for that next time I see
He was such a good sport about it. You know, we were all kind of pissing ourselves laughing about it secretly, but he would just joke about it. He said, right, you know, it doesn't work if the tongue is not in the right place. But it was funny because a couple of friends of mine and I, we went to do the course at the same time, and so a few weeks down the line, we just happened to be together somewhere, and you know, I just asked one of my buddies, you know, do you do the tongue thing as well now? And they all did. Oh, it's amazing, really. Yeah, absolutely. It kind of just sensitizes the instruments, doesn't it? You know, when the tongue is in the right place, or tongue in the cheek, perhaps.
Yeah, exactly.
Oh, brilliant. Oh, good stuff. But hey, how did you get into sports chiropractic in the first place? I'm curious to know.
Okay. Well, I was a gymnast all growing up, and into college, all through college, I was a gymnast. So that particularly got me interested. However, being an athlete myself, I really was exploring different professions when I got into college. And so my first degree is actually in teaching.
Oh, yeah.
Yeah. So funny story. I did my student teaching when I was a senior in college, and everybody fights were breaking out, and people were yelling at each other, and the principal was coming in, and I'm like, yeah, I'm not doing this the rest of my life. So I was a student athletic trainer for the school at the time.
Yeah.
And so I went and got my master's degree in sports medicine because I just found a passion for that. And being an athlete myself, it kind of resonated with me. So I started working more with athletes and traveling with teams, and that kind of how it all manifested.
Oh, brilliant.
Mm-hmm.
So, you know, it's still a bit of a leap going from sort of sports medicine to chiropractic. Was there a particular thing that drew you in?
There was.
Go on.
Okay, this is a bit of story. I'm going to try to shorten it up for you.
No, you carry on. You tell it. You spill the beans and feel the time, you know.
So getting my master's degree as an athletic trainer, I did work with a multitude of teams and prominent physicians. And what I would do as a trainer is I would work on the field, and when somebody got injured, I would bring them into the office with the surgeon, and I would actually go into surgery with the athlete and view the surgery, and then I would rehab the athlete and bring them back to play. So the great thing about it is I saw every aspect of that patient's injury, from point of injury till full return of play.
Wow.
However, being an athletic trainer, you're a little limited in your license. And you're also limited in your financial status, right?
Of course.
So I was working at the University of Notre Dame. It's a I don't know if you're familiar with that in the States.
Yeah, heard of it. Yeah.
I was working there as an athletic trainer, and I just needed a little more cerebral input, so to speak. You know, I just wanted a little bit more. So I returned back to chiropractic school, and that's kind of how I wanted a little more autonomy in practice, being able to order x-rays and blood work and MRIs, and that's something we can do here in the States. And, you know, became frustrated with my limitations. So chiropractic and being a sports chiropractor has given me the avenue so that I can see a patient and say, look, you need an MRI of this area, you need an x-ray, or let me order some blood work, see if there's something metabolic going on. So I enjoy kind of the detective work of working with somebody. That's why I enjoy the more complicated cases.
Yeah, absolutely.
Yeah, so that's how that manifests.
Oh, fantastic. Well, that's a cracking story. Pardon the pun, perhaps. Oh, these chiropractic jokes, they just roll off the tongue, don't they? Do you know what? I totally forgot to put our little bio up. Let's put that up now. So, you know, we have just a couple of bits. You qualified in '94, and before that you had your plethora of qualifications, obviously, as like you mentioned yourself. And I recall I was reading your very detailed CV earlier that we then had to kind of condense down to this bare essentials as it goes. But you've had a lot of experience with the Olympic centers in the States as well, haven't you?
Yeah, I volunteered a multitude of times for the United States Olympic Centers, and rotated in a couple of the locations up in Colorado Springs as well as in Chula Vista. Traveled with Team USA and have worked with just all types of athletes, as well as traveling for FICS. Yeah,
excellent. And let's stop that share now, so we'll get back to the normal screen. Here we are again. But so you've been to? Did you go to the Olympic Games then?
I did not. I've traveled with Olympic teams. I traveled with USA Track and Field last summer for championships. I have not been to the Olympic Games though.
Brian's got one over you then.
I know. He does.
But maybe he's got a few years over you as well.
Yes, I'm hoping so.
No, there you go. You get plenty of chance to catch up then. That's brilliant. But yeah, is that something you'd want to do? You want to go to the Olympic Games and or as part of FICS or as part of Team USA, or what's your kind of, have you got allegiance there?
I don't have allegiance. My allegiance is to athletes. And I know that sounds hokey, but really my allegiance is in all my education and all my free time that I continue learning is really to try to help as many people as I can, you know, kind of being there for the athlete. So, however, it is every sports chiropractor's dream to be at the Olympics, I'm sure. However we get there. And, you know, the mission, of course, is you're there for the athlete's optimal performance.
Absolutely. But hey, tell you what, have you got a cool, weird, or wonderful sports injury that you've seen and potentially successfully treated, or at least a really cracking anecdote? Have you got anything like that in store at the moment?
A bunch of them. So I think a great one would be a simplistic one, was a USA Track and Field person that I treated with chronic stress fractures to base of fifth metatarsal. Now, really, when you look at the base of the fifth metatarsal, there's 3 zones to it. And when you look at a fracture, and particularly sports injuries, depending on where exactly that fracture is, and we're going to talk about particularly the base of the fifth metatarsal, you can tell the origin of the fracture. So some areas of the fracture are growth center. Some areas are stress regions, stress reactions, stress fracture. And some regions are just fractures. So really knowing that little piece of knowledge just within a few centimeters of each other, you can make a better and more accurate diagnosis. So this one particular athlete came in with 2-year history of chronic stress fractures to the base of the fifth metatarsal. I asked for all the imaging and I viewed it. And I noticed it was in the stress fracture region. Okay. We have 3 zones, right? It was in the zone for stress fractures. And so then I do a lot of video analysis of the athletes. So I put them on a treadmill. We watch them walk slow. We watch them walk at a medium cadence. And then we watch them jog slow and jog at competition pace. Okay. And I video analyze them from behind and from the side. And I'm looking at symmetry of steps. Do the steps sound the same? Are they favoring one side? What's the gait, overall gait? And then from the side, we're looking at the length of the steps. Are the sides, the lengths matching from foot to foot? Are the extremities from ankle, knee, hip, all moving in the correct range of motion? And then truly understanding what are the total number of degrees we need from every joint. You know, so if I want in a runner 55 degrees from the great toe to the, you know, then I want 30 degrees in ankle flexion, I want 55 degrees in knee flexion, and then I want 30 degrees of hip flexion. And as I go up, I analyze every joint. So for this particular athlete, 2 years of physical therapy, sports trainers, orthopedists, limiting running, stopping running, boots. I put him on the treadmill and I said, you know, you don't have a foot problem at all. You really have a hip problem. So I simply mobilized his hip. Yeah. Simple. And taught him how to treat it and what stretches to do. Well, wouldn't you know, the problem went away and never came back. Well, so it's just really kind of taking the extra step and not treating somebody with what I call myopically with your blinders on, that they just have a problem. You have to be able to step back and look at the whole system. And who's better than that than chiropractors, right?
Hey, absolutely. Absolutely. Yeah. We are the world's finest when it comes to this kind of stuff.
Yeah, so that's my passion. Yeah, that's my passion, is really being a bit of detective and trying to tease out the true origin of the problem, and then teaching the athlete so that they can self-manage and carry on and continue with their training and be successful.
Absolutely. Absolutely. And that obviously means that, you know, you're making a real true difference instead of just slapping some orthotics in there and, you know, taping them every other week and kind of taking their money, you know, which unfortunately there are people like that who just do that. They can't, maybe I don't know what the motivation is, whether they just never were exposed to this kind of thinking. You never know.
Yeah, it's possible. You know, I like to think about when somebody comes in, the finances stay at the front desk and I'm immersed in the patient's care. And that's really full motivation.
No, that's right. Absolutely right. But yeah, it's funny when you're looking at the, you know, the how the hip actually, because oftentimes we look at the legs, you know, and the biomechanical chain going from ground up to from feet to the hip. But obviously, it can travel in either direction, can't it, really? Yeah, absolutely.
Yeah.
Did you find out what caused this hip problem?
Pardon me?
Did you find out what caused the hip problem?
I believe it was his footwear.
Well, bit of a rebound effect then.
Yes, exactly. So once we kind of straightened that out and I put it like a little a wedge in his shoe, it changed the mechanics of his hip position, which took the stress off the hip, which then as it came down, his strike was different and took the stress off the fifth metatarsal.
Well, there you go. So we learn something new every day, don't we?
Yeah. It's you know, I love doing that type of stuff. It's fun for me to go to work. That's, you know, I get to work and it's kind of like my exciting part of my day to work with all the patients.
No, I agree. You know, that's the fun bit. You know, you turn up in the morning and you never know what's going to actually crawl through the door, and they just tell you all sorts of things, and then you're sitting there going, let's figure this out.
Exactly.
Yeah, that's my favorite as well. Absolutely love that. And I think, you know what, in all honesty, there's a big thing now that came from those FICS courses I did a long time ago with Larry and Mike. And, you know, they kind of echoed your sentiment, you know, when it came to the whole chase it to the very end, chase until, you know, ask another why, until you can't ask why anymore, until you kind of arrived at the original sin, perhaps, you know, whatever you want to call it.
Yeah, you know, that's kind of my pet peeve. I'll be honest with you. I call it being cerebrally lazy in practice. And, you know, you kind of ask your questions, you do your straight leg raise, you do your little orthopedic tests, and you're not really satisfied with the diagnosis, but you'll put electrical stim on or adjust them and send them out anyway. Yeah. I feel like you've got to keep digging till you're truly satisfied you've met the bottom ground. Like, what's the source of the problem? And that just, you know, keep learning, keep going. You know, every course you take, you're going to learn another, you know, clinical pearl from somebody that will take you to the next level, and then you'll be able to help one more person.
That's right. Absolutely. Yeah. No, there is no such thing as a wasted course, you know, when you go and take a webinar, or it may be that one little golden nugget that comes out of the presenter's mouth, and you think, oh, actually, you know what? I've never thought of it like that.
Exactly.
It made your hour that you spent watching that webinar, made it all worth it in the end.
It's very true.
No, absolutely. Good. But yeah, it's funny. I was going to say something. Hold on. What was it they were saying just now? Chasing it and digging it to the very cause. And so being cerebrally lazy, I suppose. Yeah, it's easy to kind of just say, oh, you have sciatica. Mm-hmm. Okay, what does that sciatica mean? Why do you have sciatica? But, so you got to chase it. And, but yeah, it's a convenient diagnosis, isn't it? A lot of people don't understand.
Yeah. And, I think sometimes we don't weigh so heavily on the fact that these patients come to us and they're giving us their health, which is the most precious thing they have. And right. For an athlete, their aspirations for optimal performance, they're putting in our hands. And I feel like I take personal responsibility that I've got to be the best that I can be, because they're looking to me with this most precious thing.
Oh, absolutely.
And I feel like if I was to just not take that extra step and continue to learn and continue to drive and really figure it out for them, I feel like I'm doing them a disservice.
Absolutely right. Absolutely. Yeah. No, you know what? My grandfather, he was a farmer, and he had this way about him, old worldly, sort of been through the wars and plowed his own fields and that kind of stuff, and he was a very practical, very proud man, a typical Finn, in that sense. And I remember I was helping him paint a table, like a dining room table, when I was a kid. I must have been like 6 or something like that. So it just stuck in my memory. Anyways, so yeah, at one point I just said, Grandpa, I'm done, and just rushed through the whole thing, as quick as I could. Obviously, wanted to go and play. And he says, so what about the underside? I'm like, what do you mean the underside? He says, yeah, you got to paint the underside. What do you mean? Nobody's going to see the underside of the table. And he says, maybe not. But every time I see that table, I feel ashamed because I know it hasn't been done properly.
Right. It's true.
Absolutely. And, that's, I suppose I had that drummed into my skull when I was ever since I was a kid, and always try and turn every stone and figure it out, what's going on, what's the actual cause there. And yeah, that's something that, I hope that we can impart on as many of our future colleagues as possible.
Yeah. And, really understanding that when somebody comes to you for care, whether it's an athlete or whoever, they're there for not just one component. They're not just there because you have a fancy, nice office or what have you for your stim machines or whatever modalities. They're there for your brain. They're there for your time, and they're there for your hands, right? So I always feel like a quality visit is, or treatment is where you're giving each of that to your, to the athlete. So you're going to teach them how to take care of themselves. You're going to educate them about that condition. You're going to treat them to the best of your knowledge. And you're going to also work on injury prevention and keeping a return to sport plan in mind, because that's important.
Absolutely right. Oh, goodness me. So you're actually teaching athletes to look after themselves. So
well, remember, not every federation can afford to send someone like me or like you with an athlete for competitions, right?
Yeah.
We have some federations that can afford to spend money to have an athletic trainer, a physical therapist, a massage therapist, a sports psychologist to travel with the team. And then at the very same competition, you can have athletes there with not even a roll of tape.
No, absolutely.
So, I feel like, intercepting and trying to level that playing field and providing education also maybe puts a little more control in everybody's playing field.
Oh, absolutely right. No, I was being, it was a poor attempt at humor, that was. But yeah, no, it's, I completely agree with you. The more knowledge you share, of course, the better it is, for everybody involved. And
yes.
I mean, at the end of the day, you help somebody, and to your fullest capacity, as best as you possibly can. They're going to be happy with your service. They're going to tell their friends, and next thing you know, you have a whole queue of people waiting outside your door. So you got to beat them back with a stick at the end of the day. No, Very good. But yeah, so obviously, coming back to, a little bit to the ICSCs and hands-on modules and things. So obviously, you're personally taking charge of quite a few of these hands-on modules now. So that's going to be amazing for all the students coming in right now. They don't know how lucky they are. But also, I have been recruited or accepted, should we say, to come and help you out, at least with the one in the UK, with our friend Martin Isaksson from Sweden. So that'll be an absolute hoot in October.
We are going to have so much fun at these hands-on seminars. And I really believe, we're updating the content and changing and adding some stuff, not only so the doctors can go to their office on Monday morning and have a bunch of skills, but be excited about what they do every day, so, and they are going to be a ton of fun. And yeah, I'm looking forward to the UK one as well. I hope that goes through.
I really hope so. I mean, I'm sure this whole malarkey that is going on at the moment is going to start dying down soon, and I'm sure the seminar will go ahead. So for those who are watching, if you haven't yet got your place, I think there might still be a handful of places available for UK, or indeed some of the other ones where Christine is going to be teaching. So get your spot ASAP. They're going to sell like hotcakes once we're all unleashed from a hibernation.
That is going to be true.
Oh, absolutely. Now, obviously, there's not only the FICS content, when it comes to continued postgraduate education. I mean, I've just recently completed my FIFA football medicine diploma, which was actually quite fun, doing everything. It wasn't really chiropractically very relevant in that sense, but it was very good take on what it's like to actually be involved with the sports medical team. The vocabulary they use, the language they use, I suppose, how they think, because that again is something that I suppose a lot of chiropractors will struggle with. What are your thoughts on that? How do chiropractors integrate into sports medical teams as it goes?
Yeah. So Mika, I have a very interesting perspective on that, because before becoming a chiropractor, I was an athletic trainer. So my job was to travel with teams and take care of athletes and work in that system. And, we didn't mention, but I also have my MD degree, which I did go back and get. And I really just did that for the sake of understanding where an MD, how they're working up a patient, how they're thinking, and so kind of coming from all those different angles at once. I think the biggest pitfall that some people make is they don't know how to work with that team. So that FIFA diploma that you just got is invaluable, because when you get to an event like a World Games or an Olympic Games, and you're working with MDs and physical therapists and massage therapists, you need to understand their hierarchy, and you also need to understand what your role is.
Yeah.
And I think that makes for a successful experience. Yeah. But it also, most importantly, makes for the best experience for the athlete.
Yeah.
That they're involved in working with a cohesive group too. So that's an invaluable experience you just had. Yeah.
No, brilliant. Good. Yeah, no, it was a great course actually, and free, I hasten to add. Wow. So, a wonderful resource, and it took quite a few hours to complete. There's a heck of a lot of stuff in there. And I hasten to add, that some of the spinal modules were lacking in certain detail, but maybe there's scope for FICS to make a few suggestions. You never know, right?
Well, we're waiting. We will jump in if that's the case.
Exactly. Maybe we ought to send them a letter and just request a dialogue, perhaps, where we explore this together. That might be the way to go.
I think that's a fabulous idea.
Yeah, I think we ought to chase that. Absolutely. Good. Also, as far as I know, our friend Luke Nelson, who is the head of Sports Chiro Australia, I think they have a whole heap of resources available from there. Various different chiropractic institutions are posting stuff on their social media platforms and whatnot. So all the sports chiros who are watching, please check it out and go and find out all these wonderful things. Because yeah, like we said, earlier, the more you upgrade your knowledge, the more you're gonna, well, the quicker you're gonna be running when you hit the ground in the end.
Yeah, and I know that Luke is running a running symposium coming up next week, actually. So it's a 3-day webinar. So you can look into that as well. That's something that's really going to be cool. And I think a lot of great running content.
See the advert on that, actually. Yeah, that did look. I signed up for about 75 different things. I've forgotten half I things I signed up for. I'm just waiting for the email reminders now.
Right, I know, me too.
I just hope they do a lot of recording so I don't have to watch everything live.
Exactly. Well, that's time well spent, Mika.
Sorry?
That's time well spent.
Oh, absolutely. But yeah, no, if I have to watch everything live, I won't get to spend any time with my kids and wife, It's going to be one of those things. I'll just be stuck to my laptop. So I'll just have to sacrifice sleep and watch it all at night.
Yes, exactly.
No, there you go. Maybe over the course of next few weeks or months, just to catch up on everything.
Yeah, for
no,
sure.
Absolutely. But yeah, so that's good. And obviously on the FICS side of things, you yourself posted a few videos on, what was it, patellofemoral pain stuff on the YouTube channel as well. So I see that those have gotten a lot of clicks and views, which is amazing. Are you going to be posting more videos like that?
Yep. So that's just a short little quick 2-second thing. We are actually developing a whole patellofemoral webinar. The webinar will be on the FICS site. We have several webinars coming up. Nutrition for high performance is getting taped right now. Foot and ankle injury for the runner is getting recorded next week. We mentioned the patellofemoral one. And then we're doing one on dynamic tape. So a lot of stuff up on the webinar. So check back frequently to that, because we are really always trying to do, and a lot of those are at no charge.
Absolutely. No, that's great. Absolutely brilliant. So there'll be lots of material to keep the boredom at bay now when once we're in lockdown.
Exactly.
No, that's great. Absolutely. Hey, I always ask all the guests on the show to give a few, should we call it clinical pearls or pearls of wisdom? Have you got a top 3 for us? What would be your sort of 3 top things of bits of advice for perhaps a new aspiring sports chiropractor?
I'm going to say my number 1, and although this might sound a little hokey, my number 1, and I mentioned to it earlier, you really have to go home at the end of the day feeling good about everything you've done. And you need to understand that each patient in front of you needs your undivided attention and energy, because that's what they're there for. And I think when I drive home at the end of the day, I want to feel good about what I did and that I don't have an underlying agenda to their care. And I think that prevents burnout, number 1, and keeps you excited about, at least keeps me excited about what I do every day. So that's my number 1 clinical pearl. And although that maybe sounds a little bit hokey, I think that kind of keeps you true to what you're doing.
Absolutely.
Number 2, I'm a big education buff. I've been for years. Continue to grow and learn. In this particular profession, I feel like you can never overlearn. Every tool you put in your toolbox, you will eventually use. There'll be somebody that comes in that has, sustained concussion syndrome. You maybe have taken a class on that, or maybe you've taken the patellofemoral webinar and somebody comes in with that. So just continue to learn and grow and try to be a less cerebrally lazy, practitioner, I would say. And I don't want to say that in an offensive way. I just want to say really get engaged in trying in that patient's health and that patient's recovery or your athlete's recovery. And
you're allowed to call people lazy. That's fine,
Yeah, I know.
But you're allowed to say that. That's fine, We're not politically correct here.
I would say number 3 is find what you're really good at. And it's okay to really dive into that. If it's sports chiropractic, there's so many avenues and you can find a mentor. so many people like yourself or myself or Brian Nook love to help new docs out. Reach out to them, send an email out there. We will give you a hand up and give you some advice and help speed up your growth in the profession. Lots of people out there with some great intentions that are willing to help you. So reach out.
Oh, absolutely. And that's obviously, that's one of the new things that FICS is now introducing anyways, which is the mentorship program. Did you know about that?
Yes.
Of course you knew about that.
Yes,
Of course you knew about that. But yeah, so that's obviously something that is slowly being rolled out now. So we have a bunch of, well, I say we, I mean, I'm not developing, I'm merely put my hand up and volunteered as one of the people who are hopefully be helping out people. But yeah, so they were still taking new applications for the mentorship program, of course, and that's, like we said, is available to all young docs who are wanting that little leg up and a little bit of holding hand and sort of even just to have a little chat.
Yeah, and you'd be surprised once you get a mentor, they'll spend some time with you on a call like this or a Zoom call to go over injuries or questions you have and really help educate you in a different way, you know, what they found in clinical practice, you know, where their best results are, what technique they find gets people better faster. And that's stuff maybe you don't get from a book.
No, you definitely don't. And that's something that, you know, thinking back to when I first qualified as well, it was, I was so much in a rush, should we call it, to get into clinic and to start earning money. Well, for me, it was, I didn't have 2 pennies to rub together when I qualified. So I had to, and also I fell in love with a girl as well, which is, you know, so there was a wedding to be organized and all sorts. And so, yeah, so I had to kind of keep my head down and just plug away as much as I could. Sure. But the clinic I worked in, it was, the chap wasn't very, the boss wasn't very helpful, should we call it. So I was just left to fend for myself and figure it all out for myself. And then only once I sort of started getting into the fixed side, managed to pay off the wedding and all of that.
Right.
Then only I kind of started thinking about the whole, or being exposed to all these different things. You know, the various pearls of wisdom and clinical pearls and people sharing ideas and whatnots. And all of a sudden I realized that actually, you know what, it's not that difficult, you know. And I didn't have to make all those mistakes I made earlier.
Yeah. And you know, the thing that's unique about FICS, and I want to just talk about that for a quick minute, is there's many different organizations and there's many different associations. And the one thing I find unique about FICS is the people are really not narcissistic. They are truly giving for the right reasons. They're more of the volunteer type that's ready to give their time for the athletes. It's not a matter of their own personal gain or their career gain. It's a matter of them giving back. And it's a special group of people that work with FICS, and you know, that's something to be said. And for the new practitioner that's listening in, that also means that they're going to be there to help other people. And a lot of times you are put in a clinic and they want to get the most out of their dollar, and you're working all day without the chance to ask questions and grow. So use that mentorship program to help you. There's no cost to it whatsoever, and it just, you know, can't be bad. You know, you can get some good information.
Absolutely right. Absolutely right. Yeah, I remember the one time I managed to get to FICS games, which was CSIT games a couple of years ago, and I put my bench right next to Tom Greenway, who was absolute living legend from the UK. And so, you know, it was absolutely brilliant having a chat with him, you know, amidst everything, and sort of, you know, can you have a quick look at this for me? And, you know, how would you do this? And, you know, just getting that input also. So, you know, absolutely brilliant. And came back from the games after 4 days of labor camp, completely exhausted physically, but mentally just buzzing. Oh, this is,
you know, and that's the nice thing about the games and the world games and all the things with FICS is they like to bring in newer people that are wanting to gain experience and mesh them with mentors that have been out the field, legends, as you said. And this also kind of keeps the the system going. You know, we have new with old, and we're kind of mixing everybody together and bringing everybody together. And I
That's
think
fun.
that's really cool.
Absolutely, it is. And those are the kind of experiences, you just don't get anywhere else almost in other professions, as far as I understand. You think if you're a sports doc going to games, I mean, okay, I don't know if that would be the same kind of satisfaction as it would be, roll up your sleeves next to Tom Greenway or whoever, or Brian Nook, and just absorb all the knowledge as much as you can.
Yeah, it's true. It's true. You're right.
Good. What was I going to say? I had another point I was going to make about the games. Oh yes, you can't get to FICS games unless you are indeed in possession of an ICSC qualification.
Correct.
So that is a little tiny hang up there, should we call it? Well, it's not a hang up. Maybe it's more like assurance of your good behavior.
So we want to make sure, if you're working with athletes, that you're qualified. We don't want to put anybody on the field that's going to put an athlete in danger. And if you're on the field, you need to be able to know exactly what to do. And that's really, that's kind of, why I'm immersed in education, is to try to help anybody that wants to work with athletes, to educate them properly so that they are out there well equipped and they have the skills and the knowledge to take the athletes and treat them appropriately in the best of times and also in the worst of times.
Absolutely.
So we do have the World Games coming up in Birmingham in 2022 now, right? With everything pushed.
Oh yeah, it got postponed a bit, didn't it?
Yeah, but that gives everybody time to do their ICSC, and they can get all of those 10 modules done and the 2 hands-on modules, and then join us in Birmingham for the World Games, which is really fun.
And that would be an absolute party, I'm sure.
Oh my gosh, it's really just, it's amazing and fun and terrific and a great experience. We'll actually be staying in the dorms there, where the athletes will be staying as well, and there'll be a whole group of sports chiros going.
So how many sports chiros are going to be going for that?
I don't think we have a firm number yet. I can tell you for Poland, I believe we had almost 35.
Wow.
Chiros traveled to that, and that was the last World Games.
Yeah.
Wonderful. We had many venues going at once. The cars would pull up in the morning and everyone would load their tables on and go to their venue, and then we'd come back at the end of the evening. It was really great.
Yeah. No, that's absolutely brilliant.
Yeah.
Sounds good. Cool. Now there's another point I was going to make about the games. I completely forget now. Anyways, so in coming back to the whole clinical pearl scenario a little bit. So in terms of your second point, what was your second point again? So your first one was to.
You're quizzing me.
Yeah, I'm seeing if you paid attention to what you said.
My first one was being genuine to the patient when the patient was there. Yep. My second one is continuing to educate yourself, how important that is.
Right? Absolutely. Oh yes, that's what it was. Yes. So yeah, going back to the sort of further education and looking at all the weird and wonderful things, that are out there. Of course, some techniques or institutions run courses that you may think whether that's actually relevant, whether that's interesting, whether that's indeed is going to ever come up and be useful. But actually, you know what? Chances are that it will be. And even if it's a 1 hour seminar on some random thing about fifth metatarsal fractures or whatnot. But yeah, no, please, whoever is watching, go and take those courses. They're absolutely brilliant. And of course, they're out there for you to exploit. Now, actually, I don't know if you're at liberty to say it, but who's the most famous person you ever treated or met? Come on.
We're not allowed to say that.
Okay, well, maybe you can slightly describe without giving away the name.
I have treated many Olympians over the years, with having the very, very positive and fortunate experience of working at the Olympic Training Camp and working with some great sports chiros at the Olympic Training Center too, by the way. They're also wonderful. So not really allowed to give names, but I will tell you a multitude of sports. But I have worked and traveled with Team USA Gymnastics as well in some of their events. So the people that you know and have seen in the Olympics, I have worked with.
Oh, phenomenal. You know, local to me, there's a relatively well-known acro gymnastics club as well. Both of my daughters been practicing there for a couple of years and a few years now. And I mean, those are phenomenal athletes when you watch the gymnasts at full flight. Goodness me.
Yes.
And personally treated a couple of the sort of world champs and who came from the club, and yeah, it's absolutely outrageous the kind of things they can do.
Yeah, it is pretty amazing what the human body can do with training, right?
Absolutely.
Yeah.
And do with control. Not just, you know, be forced into doing, but actually do it and control it.
Yeah, well.
which also kind of is actually brings up a funny story. So one of these gymnast girls was coming to see me with a low back problem, and it was one of those things. She was so hypermobile that it's virtually impossible to adjust her. And you know, you put her in a side posture, and you kind of twist her around a few times before you get any kind of tension happening in there. So in the end, we you know, I was open about the whole problem. I just asked, you know, any ideas what we could do, and so we kind of put our heads together and thought, right, next time when she comes in, just wear a really tight pair of jeans, because what that would do, it would just kind of immobilize the pelvis a little bit and let us isolate those lumbars. And she did that, and it worked like a dream actually.
Wow, thinking outside the box.
Yeah, exactly.
So I'm going to tell you a trick for gymnasts or hypermobile people like that, dancers, gymnasts. Here's the little trick. The smaller they are, the harder they are, right, to adjust. If you put them in side posture and flex both knees up at the same time instead of just the top leg, you know, conventional side posture where you bring just the top knee up. Yep. If you flex both knees at once and roll them towards you, you can get to the lumbars a lot easier.
Ah, there you go.
Here's the trick.
See, where were you 8 years ago when I needed this information? There you go. No, that's absolutely.
It worked, so you go with that.
Oh, I will never forget that now, I tell you.
Exactly.
I will never forget that. You know, when I need to adjust my kids, I know how to do that as well.
Exactly.
Yeah, that's brilliant. Good.
And then start them on their back. So they're on their back. You do a knee to chest.
Yeah.
Lock them in and hold the sacrum, then roll them towards you and adjust them.
Ah, well, there you go.
Yeah.
No, that sounds like a brilliant. See, there is a top clinical tip right there.
There you go.
I've learned something new again this evening, which is brilliant.
Glad to help.
Absolutely right. Good. Hey, listen, have you got any other bits and bobs you want to impart onto our viewers at this point in time?
Bibs and bobs. So what exactly do you mean by that?
Well, you know, random other clinical pearls, any kind of other bits of wisdom you want to impart at this point?
I think that taking some time to learn skills like taping are important, particularly dynamic tape. I use a good amount of taping sometimes for diagnosis, which is interesting because if you're unsure, if you're looking at a gait of somebody, let's go back to the example I gave with the base of the fifth metatarsal stress fracture for 2 years. Sometimes if you, maybe I'm thinking it's the knee, let's pretend, right? And I tape the knee for stabilization. Maybe I use dynamic tape or maybe I use rock tape, and they still have the same symptoms. I've ruled out that diagnosis. So I know it's not a knee problem.
Oh, gotcha.
So you can use tape for stabilization, but you also can use it to help come to your conclusion as a diagnosis.
Okay.
So those taping skills are very important. You know, we do go through those in the hands-on module. You'll learn a bunch of taping. We also have a dynamic tape sponsor that does a great job giving us some webinars. And he also has some classes to learn. I think that if you're going to work with athletes, that's one skill that's really important.
Absolutely. That sounds very useful. Do you know, I wasn't really aware of the real diagnostic aspect of the testing aspect of the taping procedure. You know,
that's a secret.
Well, yeah, don't tell anyone.
Don't tell anybody. I just started doing it when I do my gait analysis, because sometimes you're hedging between two different joints, right? So maybe two joints seem hypermobile, or the gait, you have faults in two areas. But if I block one out and I still have the same symptoms, well, then I've ruled that out as the causative agent. So I think I maybe made it up.
Good.
All right. I'm not sure.
But you know what? It makes perfect sense.
Mm-hmm. Right.
But now all you got to do is get a whole bunch of funds together and get some kind of a double-blinded RCT done on that. And
exactly.
Yeah, exactly. So then we can poo-poo it completely after that.
Right. Exactly.
You can prove it doesn't work.
You know, listen, research-driven, practice-proven, I say, right?
Yep.
Yeah.
No, research is great. You know, don't get me wrong. You know, it's very important because, of course, it helps us explain phenomena in the world. You know, whatever it may be, it gives us ideas, gives us an interpretation, perhaps, and that's very important. Also, then you have to marry that up, the research knowledge with clinical knowledge, and that is what gives you the true sort of driving force behind your clinical decision making. Would you say?
I do, and I think I'm a big research person myself. I'm always reading articles and updates and trying to stay ahead of the curve on research. I think we need to kind of sometimes understand that not every patient falls into the same slot. And even if we have 10 patients, or let's pretend it's an N of 100, they all will have different nuances with them. You know, one of the things I lecture about is structural insufficiencies. I don't want to say insufficiencies. Let's say structural differences. Mm-hmm. Let's pretend that some of us have normal femoral position and some of us have femoral anteversion.
Yeah.
And some of us have femoral retroversion. We can't really analyze all those people the same when we're looking at a gait analysis, right? Yeah. And then also we can't expect each of that person to go through functional movement patterns the same with femoral positions in different places.
Yeah.
So we need to also understand sometimes, you know, looking at the research and trying to dive a little bit in differently when we're looking at the human frame and understanding there's so many variations to normal on the human frame that we that's why I said research driven, practice proven. We need to look at the research, it's imperative, and keep that in mind, but we also need to know what works in clinic, you know, what gets the patient better too. Mm-hmm.
And what works for that particular patient, you know, because they might be that one patient who you ever see who has one hip, one femur in anteversion and one in retroversion.
Yeah. Yeah. And you need to be ready to catch that.
Exactly. There you go. And that's unfortunately something that, you know, well, I don't know. I doubt it would be impossible to accommodate in a research setting, but it would be really quite difficult, would you say?
It would be difficult to get an N of an adequate amount to provide a statistical analysis, I would imagine, right?
That's exactly right. So therein lies the conundrum.
Yes, exactly. To the point.
Absolutely right. Good. Hey, listen, you know what, Christine? I think what we're going to do is we're going to probably leave it at that this evening. It's been an absolute pleasure having a chat with you about various things, education, and obviously sprawling in one direction and the other. So always great talking shop with like-minded people. I very much enjoy that. And but just a quick recap. So obviously FICS is doing lots of wonderful learning materials for all of you people who are watching. So check those out on the website. If you haven't yet, sign up for your ICSC program, or if you have the old qualification, the ICSP, so you can upgrade that or change that to an ICSC with the head injury module. There's all the freebies out there on the website and now on the YouTube channel as well, which is great. And we'll see you hopefully at the Handson module in the UK.
That would be so fun. Yeah, that'd be great. I'm looking forward.
Brilliant. Good stuff. Well, hey, listen.
Mika.
thank you very much for taking the time to be on the show this evening. And we'll look forward to chatting again soon.
Yes, thank you. You take care. Stay safe.
I shall. All right. And you.
Bye-bye.